Here's a guy who knows a lot about elections, but we're going to talk, well, and this may be an election issue. Simon Lono, Healthcare. How are you today?
Good day. How are you doing today?
I'm all right. What's on your mind on the health file?
Well, before I get to that, just because I was listening to John Iverson, and I'm a big fan of his writing, there was also a poll out today that showed that something like 45% of people want to keep the Senate.
Yeah, that's right.
And another 45% want to eliminate it, and about 15% want to, keep it the way it was. For Newfoundland, I think getting rid of the Senate would be a profoundly terrible idea.
And that's a common theme, as you know, Simon, across the Atlantic. There is that argument, as I think we were articulating, that it's an important vehicle of representation for us. We generally have had pretty good senators as well. None of them are being called into disrepute at the moment. But anyway, continue. Sorry.
Well, the Newfoundland parliamentary delegation is 7 MPs and 6 senators.
Yeah.
Why would any party in Newfoundland advocate for the elimination of half of our parliamentary delegation? It makes no sense. Mm-hmm. So, but anyway, leave that off to one side, because that's going to be an endless, long-term discussion.
Yes, it may be as long as the 150 years that Canada has been in play. We may get to the 150th anniversary and still be talking to the 300th anniversary about the Senate. But
yes, it will still complain and still be unhappy about it. Jeez. I wanted to talk about healthcare, and particularly there was an issue that showed up this past week. A problem over at Western Health in terms of...
This was the faxes and people's information coming out, and yes.
Yeah. And I'd like to just put that little story in context.
Okay.
One of the problems that we talk about in Newfoundland is, the problems with our healthcare system. And one of the solutions that keeps coming up is we need to pour more money into it.
Right.
And if we pour more money into it, that's the solution. Well, it turns out that over time, the federal government, for example, has been increasing the amount of money they've been putting into healthcare in the country by 6% each and every year. What has happened is that we have gone from a problem of an underfunded healthcare system to a system of well-funded problems. And
go ahead.
If you bear with me. One of the things that we've been doing here in Newfoundland is the Centre for Health Information. Mm-hmm. And the Centre for Health Information has been, for years, has been spending millions of dollars each and every year with the ambition of creating a electronic health record system. Okay? After the millions of dollars that we have spent with the ambition of creating a electronic health record system, what was the news that comes out last week? That patient health was put at risk because Western Health couldn't manage a system of putting out faxes. Mm-hmm. Faxes. Now, faxes are no form of electronic health record of any kind. And, really think about this for a moment. When was the last time you relied on faxes for anything?
I sent a fax once this year simply because the place I was communicating with didn't have an email address and I had to send a document. But it's once probably in 3 years that I've sent a fax.
Last August, one of the health authorities apologized to 52 patients because of another fax botch.
Yeah.
Last May, there was yet another example of them just messing up the transfer of information from the health authorities to individual doctors because they use fax systems. They use fax systems in the face of like I said, the millions of dollars. It's got to be over $100 million now that we've spent on trying to develop electronic health records, and they are no further ahead than when they started. So my question is, how can people say that we need more money into the system when what we really need is proper management of the healthcare system? Because, if you talk to, we have our doctors as good as anybody else's. Mm-hmm. Our nurses, our LPNs, all the frontline staff, they're quality people, quality training, quality experience. If you ask them what the issue is, they'll tell you that it's the management of the healthcare system that's putting us all at risk. And we can't afford to keep putting in 6% more and more every year.
If it's not working the right way. No, that's, good debate to get started here this morning. I'm going to have to leave it there unless you go another 20 seconds if there's anything you want to add. Otherwise, I've got to go to break.
No, I just want to toss that idea out there. I think that people really need to consider what kind of work we need to do with our healthcare system in order to make it the kind of system that we need to have to maintain our proper health.
All right, well, all are welcome to comment. Good for you for throwing it out. We'll see if we get any reaction. Thanks, Simon Lono. Good to talk to you today.
Take care. Have a good day.
Bye.
Bye.
All right, Simon Lono there.